Welcome to Signs Elderly Parents Need Care, Creating Strategies and Initiating Conversations. I'm Pamela D Wilson, Caregiving Expert Advocate and Speaker. I am your host and your instructor for this module. This module takes us into the idea of understanding medical care for elderly parents and becoming a more active participant in the healthcare system so that we can get the care that we want. I will begin by doing a quick introduction and some housekeeping, and then we will get along with the slides. You will see me down here in the corner of the slides throughout the program as I come in to share stories and information. Let's talk about housekeeping. It's all of the normal things. By now, you know that I use the term elderly parent or elderly parent for the person for whom you provide care. The outline for this module is in the course materials. You can print it out as well as the slide handouts for each section so that you can make notes. The ellipses, the dots are purposeful so that you can follow along with me throughout the presentation. Let's talk about the objectives of the entire module, and then we'll go into the objectives for this part. At the end of Signs Elderly Parents Need Care, Creating Strategies and Initiating Conversations, you should be able to identify the connection between aging and health declines that are not always necessary. You should be able to illustrate how chronic diseases are interrelated, and to implement an action plan for elder parents to receive better care from the medical system and the healthcare system. In looking at the objectives of when you know something is wrong and learning medical speak, what you should learn by the end of this part is how to relate to medical speak, what medical speak terms are, and to become more familiar with them so that as you're working with the medical and the healthcare system and you hear these terms, you know what the providers are talking about. You should be able to explain and give examples of ADLs and IADLs. We'll talk about what those are in a minute, and to recognize how changes in activity level impact health and well-being. Learning medical speak is a barrier for consumers, caregivers, and patients. And I say a barrier because medical speak are terms and acronyms that healthcare providers use, and they assume that we as consumers know what they're talking about, and we don't. That's why I say that medical speak is a barrier for consumers, for caregivers, and for patients. By learning the terms that I will share in this and all of the modules, you'll gain a greater understanding and a better level of confidence to be able to navigate through the healthcare system and understand what the medical profession is saying to you. The first two terms, ADL and IDLs, are acronyms, and they're used by the healthcare community for activities of daily living and instrumental activities of daily living. These are activities that most people perform regularly. These terms are standard medical speak. You'll hear them from doctors, nurses, and other care professionals. You'll also hear other terms. If you hear something that you don't understand, make sure that you ask. If you know the meaning of ADL and IADL, you can then ask questions and have better conversations with the healthcare professionals who are taking care of your elderly parent. ADLs are considered necessary survival skills. They're things that we do every day. As we age, these simple ADL tasks become more challenging to perform because of a number of reasons. Being unable to perform ADLs are the primary reason that elderly parents leave their homes to move to care communities or nursing homes. If you have a pen near you, take it out because I want you to list these ADLs. I want you to write them down. ADLs, activities of daily living, include bathing. Bathing is taking a bath. Bathing is taking a shower. Bathing is washing your face, any type of hygiene. The second one is dressing. That's the ability to put on clothes, your shoes, coats, jackets. Third is eating, which means picking up a fork and knife and feeding yourself and swallowing. The fourth is toileting, and that means using the toilet, but it also means for older adults managing incontinence. The fifth is transfers and mobilities. That means walking, sitting, the ability to stand up, to lie down, to transfer from place to place. So relocating from a bed to a chair, a bed to a wheelchair, even getting in and out of the car is considered a transfer. Let's look at the IADLs. These are instrumental activities of daily living that go hand in hand with activities of daily living. IADLs, or instrumental activities of daily living, are activities that extend beyond physical functions to activities that support living independently. Most of our elderly parents want to remain independent and to live at home as long as possible, which is why being able to perform ADLs and IADLs are very important. Take out your pens again, get them ready. I'm going to give you a list of IADLs. Instrumental activities of daily living include cooking, cleaning house, doing the laundry, grocery shopping, and running any type of errands. IADLs include managing money and paying bills, driving a car, using any type of public transportation, using the telephone to make appointments, request information, talk to family. Also includes managing and taking medications, and managing and setting up other household projects like home repairs, lawn mowing, snow removal, and so on. As you can see, when you combine the ADLs and the IADLs, they are activities that we do in the regular course of every day. Difficulty performing these activities has a direct link to disability and chronic diseases. Having a chronic disease can make any one of these activities more difficult to complete. So how does that happen? Having a chronic disease can make performing ADLs or IADLs more difficult. Difficulty completing these activities link to chronic disease, physical declines, and more health problems. For example, having COPD or any type of breathing issue can make performing activities that require physical endurance more difficult. Our bodies need more oxygen. We breathe heavier when we complete physical activities, when we work out at the gym. Anything that involves any type of physical exertion gets our heart pounding a little bit, and we're breathing a little heavier. Another example is arthritis. That can cause elderly parents to limit physical activities. Then what happens is low physical activity results in body weakness. It makes it difficult to walk distances, longer distances, because people who have arthritis can get stiff, they can have pain, and they can have poor balance. So they're afraid to walk a lot because they're afraid to fall. Difficulty performing these ADLs and IADLs vary by the diagnosis of chronic disease, and they benefit from the use of safety equipment and accessibility devices. Some of your elderly parents may already use a walker. Maybe they have some safety equipment in their home. So anybody who has a little bit of difficulty getting around benefits from this type of safety equipment. We go into a deep dive about safety equipment and accessibility devices in the module that is called Home Safety for Elderly Parents, Tools and Tips. ADLs and IADLs can be categorized into different types of mobility issues. Walking, transferring in and out of bed, in and out of a car, and climbing stairs. Self-care activities are categorized as eating, dressing, toileting, and bathing. Household activities relate to meal preparation, grocery shopping, using the telephone, taking medications, managing money, laundry and cleaning the house, managing household projects, and driving in any type of transportation. Let's talk about some research that substantiates concerns with ADLs and IADLs and the high number of people that are affected. According to the Center for Housing Studies at Harvard University, 41% of older adults who are between the ages of 65 and 79 have at least one self-care, household activity, or mobility disability. Those are the ADLs and the IADLs all combined. So they have at least one of those that they cannot complete. And then once we get to age 80, that 41% rises by 30% to 71%. And most people over age 80 have more than one of these activities that they can't complete. So why is this important? If we recognize these early recognition of any type of difficulty with ADLs and IADLs can help caregivers and elderly parents realize that there is a problem, that there's a health problem, and to take steps to prevent or delay further declines, regardless of the age, regardless of physical activity issues. And the support for these are walking, endurance, and strength training. Those both help older adults be safer when trying to perform these activities. So why are these numbers important or relevant even for us who are younger and our elderly parents? So the source for these statistics are an ASPE research brief from April 2019. 48% of people over age 65 eventually receive some type of paid support, and that would be paid support in the home. It could be paid support from Medicaid, other community programs. 29% eventually use in-home caregivers. 5% move into care communities. 28% spend at least 90 days in a nursing home for some type of health problem or physical disability. And 13% eventually live in nursing homes. The statistics between men and women differ. Women are more likely to need care. 75% of 65-year-old women develop severe care needs before they die, compared with 64% of males. So there's a 10% gap there between males and females who need care. Women are also about 2/3 more likely than men to receive long-term nursing care over their lifetime, 34% to 20%. We talked about that earlier. And women are also nearly twice as likely to receive long-term Medicaid financed by nursing homes. 17% women, 8% men. And this is because in midlife, women experience more levels of physical disability regarding things that they can't do that they could do weeks or months earlier. We talked about this earlier also. So this is a kind of a little reminder that women eventually need more care than men. It's a reminder to look at these statistics, because knowing these statistics can help us as caregivers and our elderly parents understand the benefits of being proactive before any of these things happen. Help us understand the benefits of positive health habits like exercise, like good nutrition, like managing our weight and avoiding smoking. Caregivers notice changes in themselves and in elderly parents, but because we don't talk about these changes often in elderly parents, you may not realize the significance of some little thing that just happened and how it turns into a big care need. Medical professionals have a lot of screening tools that they use for physical activity, nutrition, depression, and other concerns. Realize that elderly parents, when they go to doctor appointments, may overestimate their abilities and the activities that they are able to perform, which can skew the results of any of these exams. But when caregivers attend medical appointments, you can always ask for permission to add your perspective about the way your parents are answering elderly questions, especially if they are saying that they're better than they really are. That doesn't allow the doctor to do an accurate assessment. In this module, I have included a screening tool, and it's called the French Activities Index. That index may be helpful in speaking with an elderly parent to identify changes in daily activities. The index has guidelines for asking about the activities, and it also has definitions of the activities so that you know that you are asking the questions correctly and documenting correctly. I recommend document the answers by your elderly parents. Use those responses as a basis for a discussion with the doctor to identify concerns and to develop some kind of plans for physical activity, whatever type of lifestyle changes would be beneficial to address the areas of physical weakness or inactivity. You want to document, monitor, and compare the information from the index, I would say very often. Initially, maybe monthly, then every 3 to 6 months if you're not seeing big changes or if you're seeing improvement. This type of tracking will allow you to confirm whether the activities of elderly parents are stable or declining. All of these little things, the little details make a difference in helping elderly parents stay at home. These efforts, I know they can feel like work, it can feel like another job, it can feel like one more thing to do. When we think of activities to support good health as part of a daily and weekly routine, and we make it part of life, completing these activities seems to be normal once we adjust to the initial change. Let's look at why physical activity is so very important. A formal definition of physical activity is any body movement using muscles that take energy. Being more physically active is associated with better status in all adults, especially our elderly parents. Lower physical activity results in being tired all the time. Physical activity at all ages is essential if we want to keep going, remain independent, and reduce the likelihood of physical injuries. There is research out there that confirms the benefits of exercise interventions. Get your pen again, write down these percentages. 70% of studies showed a fall reduction, 54% better gait, 80% improved balance, 70% increase in muscle strength. Those are high percentages, which indicates that a little bit of effort, a little bit of activity can go a long way in helping ourselves and our aging parents stay in good physical condition. So let's talk about what we learned from when we realize that something is wrong, but we're not sure what it is, and medical speak. Noticing changes in ADLs and IADLs represent a stop-gap opportunity to prevent increasing care needs. Using the French Activities Index can help you identify concerns, share that information with the doctor, develop an activity plan to maintain strength and improve safety. Engage elderly parents in the process so that they participate. And most of all, my recommendation is that you also participate in the process yourself. As caregivers, we can learn so much from being caregivers for our elderly parents. We can learn things that we should be doing today that we may not. We can establish positive lifestyle habits for ourselves, help our elderly parents do the same, and model these behaviors for our children and for others in our family. Because as we talk, caregiving is a generational issue. If we have extended family, meaning we have children, parents, grandparents, Caregiving will affect every generation, every aspect of our life. The more that we know, the better we can become prepared and the better we can take care of ourselves. I'm Pamela D Wilson, caregiving expert, advocate, and speaker. Thank you for joining me for this webinar. It was my pleasure to be with you, and I will look forward to seeing you in the next webinar.